Hey guys, you're listening to By the Numbers, a public health podcast, and today we're talking about gun safety. Stay tuned. Welcome to By the Numbers. I'm Addie Olson, the Public Health Communications Officer with the Polk County Health Department. And today we're talking about a significant milestone for the Health Department. It's the one-year anniversary of our Talk It Up, Lock It Up gun safety campaign. And in the first year of this campaign, we have distributed over 1,700 gun locks across Polk County, thanks to the support of many awesome community partners who have made this campaign happen. So today I'm joined by two guests to talk about the importance of gun safety and what this campaign's all about. The first is Helen Eddy, who is the director of the Polk County Health Department, as well as Dr. Amy Shriver, a pediatrician and the president of the American Academy of Pediatrics. So thank you both for joining me today.
Thank you.
Yes, thank you for having us.
Absolutely. And Helen, I wondered if you could just get us started by talking about how and why this campaign got started and the two components, Talk It Up, Lock It Up, and what those mean.
Sure. This campaign really emerged out of community conversations that were already happening back in the spring of 23 around youth gun violence, really grew out of the two school shootings that happened at East High School and at It Starts Right Here. And those conversations had begun to happen in our community. Our community felt the need to do something about it. And the people involved in those conversations reached out to the health department and really wanted to engage public health to get some ideas about what might be a public health approach, taking that big prevention approach, look at a situation like this or an issue like this. And so we began our research, and through that research, we found that there were some things that were emerging, that safe gun storage was really one of those strategies that we saw other county public health departments, a few of them across the country, engaging in. The American Academy of Pediatrics had a wonderful set of toolkits and things, and they were endorsing safe gun storage as an approach that their practitioners and members should use in their own practices. And there was also Be Smart for Gun Safety. That initiative was happening. So as we looked at what was out there, really, safe gun storage kind of rose to the top as maybe an approach that we could embrace as a community. And before we launched this campaign, we really did our homework. We did talk to our health systems to get their buy-in, because we never wanted to assume that this was something that would be comfortable for them or another thing that their practitioners could do. So it really was grassroots coming out of the community when we decided to launch this campaign.
And I think one of the things that's become really apparent to me is just the level of collaboration that it's taken to get this campaign off the ground. So can you speak a little bit to all of the partners that we've had in doing this, and I guess even how it arose through some community conversations?
Well, the partners really are kind of wide-ranging. I mentioned our healthcare partners. They're all in. We wanted to make sure that our law enforcement partners were also engaged in these conversations. Many of them already had free gun trigger locks, but the community didn't know that. The other partners that we engaged actually was through some suicide coalition work, was the Veterans Administration, and we found that they had an active program distributing free gun locks at gun shows and in pawn shops, and were including information about suicide prevention. So they were an important partner because they have been the source for us for our free gun locks that we're distributing across the community.
And the free gun locks are the Lock It Up piece.
Yes.
And that Talk It Up piece is all about just normalizing the conversation about gun safety, right? Making sure that we're actually talking about it more than we currently do.
Yes, I mean, we feel that we need to normalize this conversation, and the Talk It Up portion of it really comes down to I'd say two pieces of it. We're leaning on our healthcare partners and encouraging them to have these conversations about safe gun storage with the parents and caregivers when they see those kids in their offices for their well child checks. So when we talk about car seats, outlet covers, swimming pools, et cetera, this is just another piece of it. And then it's also having parents and caregivers talking to other adults and families and things in their lives where their kids go to spend a lot of time. Because nationally, there's a statistic that says there's a 1 in 3 chance of your child going to a home with firearms that are very likely unsecured. And I think people don't think about that and don't talk about it. And I think it's important for us to stop right now and really, what is safe gun storage? What are we asking people to do? We are asking them to store their firearms locked and unloaded with that ammunition stored separately from the firearm. Safe gun storage is not hiding it under the mattress, not sticking it in the nightstand. Kids are curious. They know where they are. They've all seen them. They've all fiddled with them, let's say. So that's what we're asking people to do. And we're asking people to have those conversations about safe gun storage. We want to normalize it.
And I think as a parent, it's just something that I hadn't had on my checklist of questions to ask before my kid goes somewhere. You know, what snacks do you have, or are your outlets covered? Those are things that I'm thinking about. But gun safety should definitely be part of the conversation. And Dr. Schreiber, you're having conversations like this with parents and caregivers every day. Can you just talk a little bit about your why and your main motivator for being involved in this work?
Absolutely. So I've been working on gun safety and safe gun storage for over 13 years now, and it really got started after Sandy Hook. So I've been a pediatrician for a long time and a mother for 16 years, and when Sandy Hook happened, it really impacted me. My kids were that age, and at the time, most of my patients were also that age. And, you know, there was just a lot of personal and community and national grief around that. And so I decided that, hey, maybe there was some way that I could use my expertise in child health to channel some of those feelings into advocacy. And so I've been working with pediatricians across the country, pediatricians from Highland Park, Illinois, and pediatricians from Uvalde, and all over the country, who have the same sort of passion about keeping our kids healthy and safe. So I do have these conversations, and over the past 15 years, I've just seen the trending of, you know, kids having more and more serious injuries and deaths related to guns. And in 2020, gun injuries became the number one cause of injuries or death for children in the United States. And so I've been watching these trends go up and up and up over years, but it really struck me that I don't think that people out in the community have really seen those trends as much as we who work every day with children do. And so I thought it was really my responsibility to talk about it and to share that information with patients. So when I talk to families, I start at age 1 because that's the age at which the risk really becomes number 1 for kids. And I also kind of enfold it with the rest of my anticipatory guidance that I do at every well child visit. And I say, make sure your child is properly restrained in their car seat. If they're of, bicycling age, we talk about helmets. We talk about water safety. And then at the end of that conversation, I say, and if you have any firearms in your home, please make sure that they are locked, unloaded, and have the ammunition stored separately. And then I give a little pause to let that sink in, because not all families are expecting that conversation. As you said, it's not something that we have been talking about in the past. And I get a number of reactions. Some reactions are, oh, we don't have guns in our home. And some reactions are, oh, we're storing them correctly. But a lot of times the reaction is just surprise and a bit of confusion as to why this is even coming up. And so that allows me a chance to really further talk about the statistics, about how, did you know that guns are the number 1 cause of injury or death in your child's age group? And most of the people that I talked to did not know that, but then become a little more interested in the conversation. So, when my parents say, oh, we don't have any guns in our home, I always say, hey, that is really the safest way to keep your kids from unintentionally injuring themselves from a gun, is to not have one in the home. But 1 in 3 households contains a gun. And so you're going to have to ask. So we talk a lot about asking. The American Academy of Pediatrics says asking saves kids. That's the acronym. And it's hard for parents to ask. So how do I help them ask? I say, hey, you can do this either face-to-face, or if it's easier for you, to do it via texting. I think over the last 10 years, texting has become a reliable source of communication, but also kind of an easier way of dealing with some of these topics that might make people feel a little uncomfortable. So I say, would you please then send a text before your child goes over to grandma's house or your relative's house for a holiday, or your child's new friend from school that you've not met before, and say, hey, before my kid comes over, I have a few safety questions, one of which is, are you practicing safe gun storage in your home? So I think that's a way for families to begin that conversation. And some families say, I already talk about it, which made me feel great. But most families hadn't had that as part of their conversations as they send their kids to other homes. So I think that's really where pediatricians can make a big difference, is to have parents reflect on their own safe gun storage habits, or to reach out to us if they need help finding gun locks or gun safes. And we do have some of those. At Blank Hospital, there's a safety store where you can buy either one of those things. And as you said, it's often possible to get free gun locks from different resources, and we can help parents do that.
Absolutely. And I think that it was shocking for me when I first learned that firearms are one of the leading causes of death for children and young adults. And we were looking back at some data from Polk County between the years of 2018 and 2022, and found that on average, 12 children and young adults between the ages of 1 and 24 have lost their lives in Polk County per year here to gun injuries. So I guess from your perspective as a pediatrician, what can we do to stop this from happening?
Well, I think one of the key things is to ask ourselves why. Why are these numbers increasing? And really, I know that's a public health way of thinking, is to find the root causes. And one of the causes is that there is just we need to do more education for families about topics like this, about the fact that this is an increasing threat to our children's health. And we also need to realize that there's sometimes too much access for children, and that we need to really respond to that and make sure children don't have access to loaded firearms to keep them safe. So that's really one thing, is to say, hey, let's make sure kids don't have access to this, and then let's do a good job in our wheelhouse of educating children and families. So again, I think it's important to dispel some parental misconceptions about their children. So a lot of parents think that their children have no idea where the gun is hidden. And the answer is the children know. Mm-hmm. Up to 75% of children can identify where the gun is if you ask them.
Kids know everything. They know where everything in the house is, you
right.
know?
And some parents think that my child's too young to be able to manage a gun. And honestly, at age 3, a child can be strong enough to pull a trigger on a handgun. So it's important to know that even very young children can harm themselves accidentally if they come in contact with a loaded firearm. And then parents perceive that if they teach their kids not to handle the gun, that kids won't touch the gun, and they'll go tell an adult, as they were taught. But it turns out that over half of children will touch the gun if it is available, and only a quarter of children will talk to their parents about the fact that there's a gun lying around. So I think there's a lot of misconceptions we can teach families about to really keep people safer, and really just to increase alarm bells for families to know that this is the number one public health issue for children right now.
Absolutely. And also, these types of incidents are they're obviously very tragic for the family and those directly impacted, but they really have a ripple effect. It's not just contained to that family. It spills into the trauma experienced by somebody who is treating and helping this young child, their extended family and friends, and really the community. And I think sometimes we become a little bit, as a whole, maybe desensitized to that. Can you talk a little bit about what it's like to actually see this happening, kids coming in with firearm injuries, and what it's like to be on the front lines of that?
Well, I'd like to speak in my wheelhouse, and I have taken care of children directly who've come in with firearm injuries, but now with almost 20 years of primary care experience, I don't really work on the front lines with kids, but I do work with a lot of other physicians who do. So our emergency medicine doctors, our doctors are surgeons that see the kids and help remove bullets and try to repair tissues. Our intensive care unit doctors, they're on the front lines seeing this. And I would invite you to take a look at the testimonies of over 300 pediatricians that wanted to give their opinions, thoughts, and experiences to the U.S. Senate in 2022. So there are a lot of testimonies that really show how healthcare has been transformed over the last 15 to 20 years with the rising rates of childhood injuries and deaths. So it has changed the way we practice medicine. It's changed the way primary care doctors think about protecting kids. You know, when pediatricians talk about things, we are often a victim of our own success. When we talk about prevention through things like immunizations, you know, if we are successful in immunizing everyone, then you don't see, you know, the illnesses that used to be there, like polio. But in this case, we aren't being very successful right now, and the victims are the children.
And Helen, I know that through this Talk It Up, Lock It Up campaign, we're giving out free cable gun locks. We've given out almost 1,700 that have been distributed across, or over 1,700 that have been distributed across Polk County so far. But there are a lot of ways to secure firearms and keep them from causing accidents or being stolen. So can you talk about some of the other ways that we can keep firearms safe?
Sure. I mean, cable gun locks are kind of the entry level into safe gun storage, and they're probably most effective when you have small children in the house. Older kids can figure out how to disable those. We wanted to make sure that they were widely available across a number of partners, not just law enforcement. So we've included our libraries as a distribution point for those cable gun locks. We wanted to have a comfortable place for everyone in our community to go. But you may need to kind of step it up a bit. So there are gun safes. There are biometric gun safes that you can program in a fingerprint. Sometimes the comments that we get from individuals as we have these conversations, they'll say, well, I need to have my gun by my bedside, loaded, ready to go for safety. Now, I'm not going to debate that point with someone, but there is a way to still safely have that gun, more safely have that gun next to you by your bedside if it is in a biometric gun safe that literally with the touch of a finger, if you feel that you need it, you can open it. But your child cannot because their fingerprint's not in there. So that's an important way to store them. Gun safes, again, are ideal. There are different price ranges for all of these, and I encourage people to take a look at the types of guns they have at home, the age of the children and youth that are exposed to those guns in their home, and make an appropriate selection of that. The other thing that we want to make sure that people think about, we've talked a lot about storing guns in the home, but a lot of people also have their firearms with them in their vehicles, and that is a primary place of theft. We hear from our law enforcement partners in our community that people target vehicles, and if that gun is not safely stored and locked in that vehicle, it again becomes available to someone, maybe a youth, and could be used in a way to harm themselves, harm someone else. So we need to make sure that they stay locked up.
And I think just in Des Moines, on average, they see around 50 reports of gun being stolen from cars each year. So we know what's happening, and a cable gun lock is great for some folks, but that might not be the right option for everybody. And when it comes to your vehicle, especially, you're going to need something that is secured in the vehicle if your firearm's going to be in there.
Absolutely.
And I know that we're taking this big public health approach to preventing gun violence, and have heard of some other local health departments doing similar things. But this was just earlier this summer declared a public health crisis in the United States by the U.S. Surgeon General. So are we seeing some more campaigns such as this one gaining traction on a local or national level? And what advice would you give to somebody who's looking to start something like this and prevent gun injuries in their community?
Well, Yes, it is gaining traction. We have been asked to speak at statewide conferences about our gun safety campaign, and we always say, if you're interested in starting something like this in your community, reach out to us. We want to share the resources that we've developed. They're really there for you to take and use. We've given national presentations on our gun safety campaign and had some interest from across the country. So I think it's an approach that resonates with people. When you put health and wellness of our kids at the center of a conversation, the politics are not as prevalent. And this is a kind of blame-free way of starting to have those conversations and starting to have an impact. We want to reduce the accessibility of guns, particularly to our youth, and this is a way to do it. So we've been met with really a positive response on this campaign. To others that want to start it, I'd say first start with be brave. You can do this. And if you engage partners across your community and approach it as a collaborative approach, I find that that is really, really important. We engaged health systems, law enforcement, libraries, community groups, and made sure that we were all on the same page with this. And when you approach it broadly like that, I think that also gets people's attention.
Absolutely. And we've got 1 year under our belt at the health department now. So what's the plan for the future of this campaign, and any final thoughts that you want to share with us regarding gun safety or the Talk It Up, Lock It Up campaign?
I always say we're going to keep on keeping on with this thing, because this is not a one and done. This is a long-term conversation that we have to have, and we're trying to facilitate a cultural shift in our community where it is okay to talk about guns, and it is okay to talk about gun safety, and it is okay to have these conversations, because we know that these conversations can save lives. And as you mentioned earlier, Addie, we know that for every gun lock that is out there, we have the potential to save a life and prevent an injury. So we're going to keep doing it. We're going to keep elevating the conversation. You have to be patient, and we're going to keep at it.
Yes, and I think one of the first things I asked was, did we have a number of a goal in mind, a number of gun locks that we wanted to hand out in the community in the first year? And that answer was no. Any one gun lock is a success, a win in our books.
And I think because we have used a very broad community approach for making these things available in libraries across Polk County, that has really helped us.
Awesome. And Dr. Shriver, any final thoughts on gun safety and how we can continue on in this work?
Yes, I thought Helen did such a good job of talking about our youth, not only young children, but as they mature, they develop new skills such as disabling some of the devices to protect guns, but also they develop their own set of risk factors. And so I just wanted to say a little bit more about folks that have teenagers in their home like I do. Teenagers are, we're seeing a huge rise in depression, anxiety, and other mental health disorders. And in fact, it was declared a mental health emergency a couple of years ago. And so pediatricians across the country are really working to support youth mental health. Well, one of the things we know about youth and mental health is that adolescent suicide is 4 times higher in homes that have firearms, especially those that are accessible to teens. So
wow, 4 times.
4 times higher. And 9 out of 10 youth suicides that happen via guns happen from firearms that are found in their own homes. And so we need to know that we're thinking about our teenagers, we're thinking about ways to keep them safe, and that we know that if teens get a hold of a gun and they really have intentions of harming themselves, that 9 out of the 10 times they'll be successful. So we really need to have awareness of not only our youngest children who will maybe encounter an accidental injury or death, but our teens who sometimes have mood swings or serious mental health concerns, and we really want to be there for all of our kids. And you had also talked a little bit about what are the kind of short-term or long-term ripple effects that happen. And I just wanted to say that in my practice, although I don't see the initial firearm injuries as much as a primary care doctor, what I do see are families that have been affected in the communities. So I have many, many patients that come from Perry. And after the January 4th school shooting, there were a lot of times in my office where we were just quiet and hugging and just being there with each other, because that had a devastating effect on the community of Perry as well as, the communities all across Iowa. And so I see families, I see children dealing with their friends who've been affected by gun violence. And I have had teenagers who were involved in the 2022 school shooting in Des Moines. And, my patients didn't necessarily come forward about their mental health concerns until it had drastically affected their school performance, their relationships, and their mental health. And so it has an effect not only on the injured parties and their families, but their friends and their school and their community. It has a lot of impact on the law enforcement community who needs to show up as a first responder, a huge effect on the caregivers in the ERs and in the trauma units that are taking care of these kids. And so I think we need to know that this isn't an individual problem. It's not contained within one family. This is a community problem.
Yeah, I think hearing about one child losing their life to a firearm injury is tragic, and it takes a toll on you, no matter who you are. So I really appreciate you sharing about how this impacts all of us. And it's not a political issue. Gun safety saves lives, and that's why we're here, making sure that we normalize the conversation, talk it up, lock it up. And if you would like to find a list of locations where you can pick up a free gun lock, you can find that on the Polk County Health Department's website. Thank you for joining us on this episode of By the Numbers.